Hi, good afternoon, and thank you everybody for joining us today. My name is Erin Sykes. I am the Communications Director at Resolve to Save Lives, an initiative of Vital Strategies. Vital Strategies is a global health organization that works with governments and civil society around the world to tackle their most pressing public health problems. Our speakers today are Dr. Tom Frieden, President and CEO of Resolve to Save Lives, an initiative of Vital Strategies, Secretary Arne Duncan, former United States Secretary of Education under President Barack Obama, Secretary Margaret Spellings, former United States Secretary of Education under President George W. Bush, and Dr. William Hite Jr., Superintendent of the School District of Philadelphia. And with that, I'll hand it over to Dr. Frieden.
Thank you and good afternoon, and I'm delighted to be joined by leading educators from around America. In any other year, American kids would be getting ready for the start of a school year. But this year, with the pandemic still with us and increasing rapidly in many states, it's natural to wonder if there will be school at all in the fall. Education is essential. Interruptions in education because of coronavirus have cost millions of students precious school time and have slowed or stalled educational progress. Schools are also essential for the overall educational and social development of children, as well as in the functioning of the overall economy. It's not, we think, a matter of whether to open schools, but how to do it as safely as possible. But we can't just charge forward. That's not going to work. Look at what happened in Arizona, Texas, Florida, and elsewhere. One step forward too fast, many steps backward, and for a long time. Trying to open schools without accounting for and protecting students and staff from COVID is going to backfire. Today, Resolve to Save Lives is releasing an issue brief. And I should mention that this has been in preparation for several weeks. Today's timing related to other announcements is truly coincidental. The issue is on how we can open schools carefully and responsibly to protect the health of students, their families, teachers and staff, and the community. This information is designed to complement evidence-based guidelines, such as that from the CDC, and to help education leaders make important decisions for each state and school district. The hard truth is that there is no route to zero risk of COVID-19 in the near future, but we can reduce the risk with careful planning and precautions. If we follow the best available information, we can open sooner and safer. But here's the bottom line. The single most important thing we can do to keep our schools safe has nothing to do with what happens in schools. It's how well we control COVID in the community. Right now, there are places around the country where the virus is spreading explosively, and it would be difficult, if not impossible, to operate schools safely there until the virus is under better control in those communities. The latest surge of COVID-19 cases in these states puts the communities, including the schools, at greater risk. Better control of COVID will require that we all adhere to the 3 W's: wear a mask, wash your hands or use sanitizer, and watch your distance from others, keeping 6 feet away whenever possible. With strategic testing, effective isolation, fast contact tracing, and supportive quarantine, we can stop the spread of infection. We can box the virus in, so open more of society sooner and safer. We've developed 8 basic safety measures that every school can follow to reopen this fall. First, shield the most vulnerable. Anyone with underlying health conditions that put them at high risk should participate remotely unless there's almost no COVID in the community. Second, make sure that we reduce risk wherever possible. And that may mean re-engineering some of the school environment. Reducing the number of surfaces touched by multiple people, or keeping hallway doors open. Some activities will need to end. Cafeterias may be a danger spot, and students may need to eat in their classrooms instead. Large assemblies will be out, and some extracurricular activities may be able to continue with distancing, but many may not be able to. Third, keep the virus out. Forbid non-essential visits and require everyone who enters to wash their hands and use a face mask. Everyone has to understand that children should not come to school or staff to work if they're sick. and attendance policies should be revised to reflect the urgency of staying home when ill. Everyone who works at the school should have paid sick leave. This is a policy that has been demonstrated to reduce the risk of spread of viruses. Fourth, reduce occupancy, especially indoors. Classrooms may need to operate at reduced capacity to provide more physical distance. A split shift schedule, as has been used in some countries in Europe, with morning and afternoon sessions or alternating days or even alternating weeks of in-person and remote learning, can alleviate overcrowding. Schools and classrooms can be rearranged. It's old-fashioned, but the kids can all sit in rows instead of facing each other in circles or at tables. If conditions allow, it's safer to hold class outdoors. Fifth, reduce mixing among kids and staff. Divide students into smaller cohorts or pods that stay together throughout the day rather than mixing and reforming through the day. Close staff break rooms. Unfortunately, in hospitals, some staff became infected when socializing with other staff in break rooms. Sixth, wear a mask. Students, teachers, and staff should all wear masks throughout the day, although this is harder for younger kids. You can use positive reward systems to encourage mask wearing and hand washing. Seventh, implement new health and safety protocols, including more frequent cleaning. Hand washing and sanitizing stations should be around the school and their use required. More cleaning during the day and at the end of the day and of school buses. Sharing supplies may need to be limited. Eighth and finally, prepare for cases. Despite every precaution, there will inevitably be cases at many schools, and schools need to be ready to operate as if the virus could arrive at any moment. They can respond and provide ongoing education to the best of their ability. Responding well can prevent a small cluster from becoming a large outbreak. Students or staff who become sick need to stay home in isolation until they've met CDC's criteria to return. All contacts of new cases need to be traced and quarantined. Any classroom with a reported case will need to be thoroughly disinfected and may need to be closed temporarily. And I want to make a final point. We don't live in an ideal world, and we don't have all of the information we wish we had about how to protect our children's health and future. We need to use the best available information to continue to learn so we can figure out how to improve the safety of our children and our schools, the robustness of our society, and of our economy. Reopening schools safely won't be easy, but it's something we must do to more fully reopen our society and our economy. We can succeed if we take careful steps forward and respond rapidly to new information or new cases. Our children's future depends on it. And now I'm delighted to hand over to Secretary Duncan.
Thank you so much, Tom. And I want to thank Tom and Margaret and Bill. These are all good friends who I've worked with for many years, and extraordinary leaders. Bill's living this in a way that Tom and Margaret and I aren't every single day, and just appreciate him taking the time to think this thing through together. And I'll just make a couple quick points and then hand it over to my good friend and predecessor, Margaret Spellings. First, just to reiterate a couple things Tom said. We all want our children to go back to school. As a dad, as a parent, educationally, socially, emotionally, the best place for our kids to be is in the school. Having said that, we as a nation simply haven't done the things that we need to do to make sure our kids can go back to school safely. And the fact that 5 or 6 months into this pandemic, we actually have record numbers of cases rather than declining cases. Many states with record number of cases means as a nation, we have lacked the discipline to make our communities safe and to make our schools safe and to give our children a chance to go back to school. Third, and I'm just speaking for myself on this, President Trump has absolutely no credibility, zero credibility on this issue of the pandemic and how to deal with it. He lost that a long time ago. He also, based upon these remarks, has no understanding of how schools get funded. The president doesn't fund any schools. Congress provides some funding to K-12 schools, about 10%. Most of the money, 90%, comes at the local and state level. And as tough as this school year has been, I worry a lot about this upcoming school year as those sales taxes plummet, those revenues plummet, and and schools are looking at 10, 15, 20, 25% reductions in budgets. And so the federal government, if they were serious about this and cared about kids, wouldn't be threatening to withhold money. They would actually be giving more money to school districts to do two things, both to fill that gap that's created by the lack of resources coming at the local level, but also the increased expenses of trying to make our schools safer inside for students and faculty and staff. And that absence of leadership, that absence of vision, absence of honesty is just absolutely devastating. Schools are not bubbles, as Tom said. And we as a society, we as citizens have to be willing to make the small sacrifices to give our children a chance to go back to school this fall and have amazing opportunities. I desperately wanted a large, even mandatory summer school this summer to make up for the learning loss due to COVID in March and April and May and June. We lost the opportunity as a nation to go back to school right now after the 4th of July, because again, we have not done the things that we need to do. So we all say we care about kids, we all say we care about their education, but if we as adults refuse to wear a mask, if we refuse to stay off the beaches and stay out of bars and stay out of indoor restaurants, we refuse to maintain that physical distancing, then we make it impossible for our educators to do what they desperately want to do, which is to bring as many children as they can back to school this fall. The final thing is I just want to let people know how unbelievably complex this is. Schools, school districts, everyone at the local level is going to figure this out. People are talking together. Bill's sharing with his superintendents on a continual basis. I'm listening in on some of those calls. Folks are working so hard, but school is going to look very, very different. We may or may not have cafeterias. We probably won't have choir, how we do PE, how we walk in hallways, how we clean bathrooms. All of that is going to change. We also are going to have to manage this at the hyper-local level. I'll just give a couple quick concrete examples. There may be certain teachers who can't come back to school physically because of their underlying health conditions, and they have to be allowed to teach virtually. We may have certain children, because they're being raised by grandma or grandfather, who can't come back to school because of the risk they'll be putting their loved ones at home in. We may have other children who have to come to school every single day because their mom or dad is an essential worker, and we have to accommodate them. And there may be another child who may not be able to come to school every day, may have to come on alternate days, as Tom talked about, or something less than that, so that that child has to come back. So that child who has to come back has the ability to do that, so their parents can do the critical work they're doing in our communities. So this has to be done with a level of thoughtfulness and compassion and commitment to our common humanity that we haven't seen. For all the absence of leadership that we're seeing at the federal level, what I've seen at the local level from governors, from mayors, with superintendents like Bill Hite, from principals, from teachers, that gives me a hope that we can solve this as best we can. But we have to put those decision makers in a position where they can make a good decision for their children. And if we fail to do that, they're going to make decisions that they have to make just to keep their kids safe, but are absolutely not in their best interest educationally. Let's not put our superintendents, our amazing superintendents like Bill Hite, in that position. That's my ask, I beg, I plead on that. I'll stop there and turn it over to a good friend, former Secretary Margaret Spellings.
Thank you, Arnie. It's great to see you, if only virtually. Tom, thank you for your leadership. Bill, thank you for being on the front lines of all of this. I think this is a great example of when the health community and the education community can work hand in glove to address these very, very complex issues that my friend Arnie Duncan just articulated. I think we all talk about, and you hear the president and others talk about the essential nature of schools for the functioning of our economy and for the functioning of families, working families. But above all, we must educate this generation of students, and learning loss is real for every single student. For students, absolutely yes, but for all students, our kids need to be learning actively and ongoing. And I completely agree with Secretary Duncan about the need to extend the year and the need to get students caught up for the learning loss that has occurred in the recent past. A few additional observations. We must communicate with our parents absolutely regularly and clearly. They understand that this is a complex situation, and they want to know that leaders, mostly local leaders, I think people are not looking to Washington for guidance at the moment, but they want to know that we've thought about contingencies, that we understand the nature of the complexity of these things, and that people are going to need to be able to adapt around schedules, around technology, around the needs of our workforce, around extracurricular, and on and on. But to the extent that we can plan for contingencies and be clear with them about the flexible nature of this, dictated by the health situation in our communities, we must do that early and often. I think we need to make sure that we're taking care of our educators as a workforce, just as we have been so concerned with, and rightly, the care and the health of our health workforce. Likewise, we need to do the same with our teachers, our administrators, and our school personnel. Because when they are not able to perform, then again, we've got another major problem. And so, as Secretary Duncan said, our need to be sensitive to the needs of our teachers, particularly those who have underlying conditions or who may be aging into those high-risk categories. We will need to be mindful about innovation, and this is a place where I think states and the federal government could lead, and that is to help figure out what's working, to share practices. We're learning as we go, and it would be nice if we could share that kind of learning along the way. We'll need to look at things like extending the year. We'll need to look at year-round school. We'll need to look at using our faculty and our educators in a way where our fabulous teachers are beaming out, and maybe other teachers are working regularly with students daily and connecting to their students. I know our educators want to be a big part of keeping students safe as well. And frankly, we need them to help us in that mission as well. We need to weave in our employers into these discussions, and the entirety of the community, especially those large employers, because it's going to take a heck of a lot of coordination and understanding with those employers as well. And then finally, I want to agree with Secretary Duncan and with Dr. Frieden, and that is to say that this is going to cost money, absolutely. And yes, safety is our priority initially, because it's foundational to being able to have school and keep students learning. And the various protections we're talking about, PPE, the ability to socially distance, all of these things to keep our workforce safe cost money. And I do think we should tip our hat to the Congress on the resources that came from the CARES Act, and those are being deployed by states like mine in Texas to provide free PPE to our educators, and also hotspots and the ability to access technology, which we sadly have far too many students who are unable to have those resources because of a lack of either broadband or device access. So we commend them for the CARES Act, but we will need more resources. And to echo Secretary Duncan, we've got to walk the walk on saying that we care for our students, that we care for this generation, that we care for their safety, that we understand the connectedness of American education and the functioning of society and the functioning of families in the economy. And we need to put our money where our mouths are when we say those things. And I'll pause. Off to you, Bill.
Thank you, Secretary Spellings, and thank you, Arnie, for the comments, and thank you, Dr. Frieden, for putting together the report. And that is important for districts like ours here in Philadelphia, because without that, we tend to do the things that we think are really important. And we're thinking about this work, and as the former secretaries just indicated, this is very complex. And when you're actually on the ground and living it, you understand the significant complexities to all of the things that must happen in order to return children to school. And just to put that in perspective, we have an imperative to get young people back into school. So all of these people who are claiming that we're fear mongering and doing all of those things, we want children back in school. As superintendents, as educators, as family members, as city officials, we want children to be back in schools. However, we have a responsibility to ensure that both the students, our staff members, all of the families that are involved that's done in a way that promotes their health and safety, which is one of the principles we're using as we begin to think about putting together plans that we're planning to release next week, as a matter of fact. So we're going to release our final plan next week, but it's based on three principles: the health and safety of children and staff. And those are all of the things that you heard Dr. Frieden and others talk about already. In addition to that, we want young people to be engaged. This is not just an opportunity for young people to be sitting at a computer somewhere and not having the opportunity to engage with a teacher or an adult. And particularly for our most vulnerable children, who unfortunately have been impacted more disproportionately than all of the others, because since we've been out of school, children with special needs, children who are learning English, and our youngest learners, it's really important for us to ensure that we're prioritizing a system that gets those children in front of adults or teachers on a as regular basis as possible, considering all of the things that need to be in place. And then the third principle is really around engagement, and engagement with our community, engagement with our educators, engagement with our families, and engagement with all of the other staff members who are a part of making the return to school happen. And to put that in perspective, we have instituted surveys that we have now done 2. We have plans to do 2 more. The most recent survey, we talked about scenarios in terms of how children can come back all at once, or on a hybrid model where they alternate days, or do they remain virtual, or a combination given the context, the contextual considerations of schools and or their communities. And some 35,000 individuals responded to those surveys. But we didn't just use the survey results in order to formulate the final plans. We are in a process as we speak right now of having virtual town halls. And those virtual town halls are covering very important things like health and safety, transportation, sanitation and cleaning. It covers extracurricular activities, academics. And we've had some 500 people participate in each of those. And those individuals are providing critically important feedback along the way for us as we develop this plan. So the complexity of all of these things then becomes the consideration that we actually have to be attuned to in order to make sure that we're bringing everyone back safely. I will just add that it is not without having significant partners in this space. This report is one of many reports that has informed this work. In addition to that, we are informed by our state health commissioner, our city health commissioner. We're working hand in glove with the city so that we are aligning our supports and services. And in addition to some of the other medical institutions, the Children's Hospital here, who has a policy lab that's informing a lot of what we do. And so it is not without the dedication and support and commitments of all of those individuals who are also helping us think through the complexities associated with this. And as I conclude, I want to add that I want to thank Congress for the monies that they provided for us already. Those monies have gone a long ways to help us continue to feed some 3.5 million meals since we went out in March. We're still continuing that meal program throughout the summer because we know how critically important it is. But we also had to distribute 85,000 Chromebooks just to provide our young people with access to the instructional materials that were created. And there are a lot of other things that go along with that in terms of the training and development of staff, the helping parents understand what they need to do and what they can do at home in order to help, and helping the children understand what should be done and what is prioritized, when do they need to check in and sign in. All of those things are considerations that on the ground we have to attend to make sure that we're bringing people back to a safe and healthy environment.
Thank you so much, Secretaries Duncan and Spellings and Superintendent Height. Schools play a fundamental role in our society, and reopening isn't going to be easy, but if we work together to stop the virus, we can do it. And we should, and we must, because our kids' future depends on it.